So we've got our second AI talk, which is AI in Action, Transforming Vital Steps of Outpatient and Inpatient Workflow. And we've got two orthopedic surgeons from the UK Digital Health and Care Organisation. And first up is Dr. Suhail Chughtai, who's an orthopedic surgeon and global innovator in AI-driven care. He's more than that, but that's what I'll read out for today. Over to you. We're allowed to clap as well.
Thank you. I think it's been a privilege speaking at this conference, and AI has the power to transform healthcare industry. And the motivation, my motivation to be talking here today is that I've solved many problems I faced during my career as a consultant orthopedic surgeon. I learned coding to solve my problems, and that is where my motivation comes in. So in the last 15 years, I felt that I could do better. While working, I learned the art of converting a problem into a solution by forming a software bridge. I started using medical management practice tools, developed few software, then telehealth before COVID, then remote monitoring and clinical telemedicine like virtual arthroscopy and all that. Then after November 2022, I started working on generative AI. I found that incredible leap of technology. I've never felt, I thought I had just started technology, learning technology when AI came in. And more recently, I've been working on agentic healthcare AI. And over the years, I've developed a team of 20 plus AI scientists, developers, designers, quality analysts who work with me and convert my problems into solutions. So those problems, when I apply in my practice, if they seem to solve that thing, I roll it out as a product. So let me share my story of how I solved 5 problems in NHS. I've got a few minutes left, so I'll try and cover that in this time. So I'll start with the inpatient. Patient discharge summaries. 16.4 million discharge summaries per year in NHS. Can you imagine the volume and every doctor taking 15 to 30 minutes? I thought we can do in 90 seconds. I dreamed of that. And I converted that dream into reality. And I want to show you how I did that. That is the interface I designed, where you can connect to hospital records, or you can upload a PDF file if you don't want to connect to hospital records, Cerner or Epic or Athona. You can export patient journey from this date, admission date, this date, discharge date, every part, nursing, physiotherapy, operation notes, put them as a big 100-page file, extract the information into slots, creating a very sensible formed discharge letter, which can make sense, which has a plan, which can cover the gap between information from point of discharge to the patient showing anxiety. What happened to me in the hospital? So after that, this interface is where you start the summary. You upload the file. In this example, I'm uploading a PDF from the hospital because they didn't want to integrate in the beginning. We are deploying it as a pilot in various NHS trusts. And then the file is there now. I specify what information I want to hold at the level of NHS-approved server before it goes to LLM, data protection. So I specify this, or I extract it at the NHS-approved server, Microsoft Azure, on the advanced OCR, which means I don't let the data go, patient data go to server of LLM. I redact it before that goes there. It can extract, or you can type over. And then the information is now redacted. You're ready to send it to LLM. You send it to LLM. In 30 to 40 seconds, this summary would be ready. And there is the summary format. You can see the sections. This information is being automatically sent to GP, a copy, simplified copy being sent to patient, just a layout, and then the prescription extracted being sent to the pharmacy. Now imagine being a junior doctor. I remember my days when the nurse used to call me, or the sister would, come on, do the discharge letters, patients are waiting. I was in operation theater assisting one of my teachers, Professor Angus Wallace is sitting here. He used to be one of the contemporaries of my teachers. And then I had to rush in the blues, do that, and then come back. I think the doctor can do it from theater now. He can just log in, do that, come back to theater. He doesn't have to skip anything. So this is where the summary is done. And now you can see the summary format. There's various sections. It shows what treatment patient was on before, what treatment after. So the gap of medications are covered. That's where the complications happen. Imagine patient having a problem, not being able, GP doesn't know what happened to the patient. And then the gap of information causes mistakes. So that is the format of the letter. Let me show you the PDF file. It's like this. That is what goes to the GP. A sectioned, formatted summary. So that is one area. Let's go to the patient who's discharged in the home. Another journey starts for the patient. Patient is now anxious. What happened to me in the hospital? How was I treated? What do I do with the crutches? What's to do with when should I stop walking frame? What to do with the plaster? All this intelligence, which is non-therapeutic but advisory, can be injected into a system. I'm just going to show you the system I designed. She's going to talk. By the way, she's virtual Jennifer. Jennifer used to be my first secretary when I became a consultant. And she used to put up my nonsense so much, I thought this is time for me to pay tribute. That's virtual Jennifer. I hope she's listening somewhere and she can find out.
Beautiful virtual woman.
Hello, how can I assist you today?
I have been in hospital recently. Do you know what was the diagnosis of my injury?
Of course. Based on the information provided in your records, you were diagnosed with a fracture of the tibial plateau, which is an injury to the knee.
What medications I have to take now?
Dear Mrs. Saib, currently you are prescribed the following medications. Amlodipine 5 mg tablets, take 1 daily, a total of 28 tablets. Levothyroxine sodium 100 microgram tablets, take 1 each morning, a total of 28 tablets.
How should I...
So I move on. So this is an area of outpatient. Now we're coming on. The 3 areas. I thought when the patient's at home, he can give the history and save me time in the clinic where I can ask repetitive questions again and again. And I leave the time for critical questions and proper specific examination. So I've devised a system again. Jennifer again used to come and help me. Now my patients every day, every clinic, the link goes out to patient, they click, they talk to Jennifer, they give the history, just like this.
Hello, I am here to assist you today. Please tell me your name, age, and gender to begin with.
My name is Shakil Khan. I'm 45 years of age and male.
Let's now talk about the main issue you're experiencing. What is the main symptom or problem bringing you in?
So that moves on, and then at the end, it'll summarize and send me the history like this. The email will come to my secretary, and she will save this PDF into my clinic folder, just like this. I've got these questions sorted. I will confirm if there is a critical question there. I will talk to the patient, and the patient has so much confidence that the doctor knows all about me while I walked into the clinic, and that helps me a lot. Now, by the way, the patient is still at home. Now the patient reaches in the lobby of my clinic, and that is where I think you all had faced that, how to be more informed about the patient. When the patient walks in, I had felt always short of time. I had felt that I was short of time knowing about the patient by the medical records. So I found a solution. Now I talk to medical records. I talk to medical records just like this. So I either upload a file or I'm integrated with the hospital Cerner. And then once the medical records are up, AI allows me to talk to it.
What was this patient's injury? Please give me a summary. Did this patient have any CT scan of the injured knee prior to the operative procedure? What was the result of the CT scan?
You can see it can correct. You can edit the question. To extract this
Did she have
information,
any bone
to extract
grafting
this information, I would have
during
taken a
the
lot of
operative
time. I move on to the last solution, which is when the patient is now in the clinic with me. So patient at home, patient in the lobby, patient walks into my room. That is where I take AI ambient listening software into play, just like this. So the patient walks in, I press this button. In this example, I'm dictating to the software the
I have
patient's
just
note.
seen 55 years old Christina Thompson, who had stumbled in the local superstore last weekend.
So this may not be accurate, but AI will correct it. By the way, this is non-AI transcription. Then the AI will correct it to make soap notes, just like this. You press that button, and it will summarize them. Whether you've spoken a part at the end or at the beginning, it'll slot into the right compartment. And that is the benefit of ambient listening AI. I write prompts, so the prompts are directing this information going into slots. So in this way, it's a very short demo because time is short, 10 minutes. So if you want more, we have a conference going on at the RCP on the 5th of November. We'll be demonstrating that in more detail, and this is just to declare my associations. I will be leaving a copy of this presentation on my LinkedIn. So thank you very much for your very patient listening.